My name is Michael Combs. I am an internal medicine resident at the University of California, Los Angeles, but I do want to mention that the majority of this work took place while I was a medical student at the University of Chicago. This video is associated with the article Substituted Judgment in Principle and Practice, a National Physicians Survey, which will appear in the Mayo Clinic Proceedings. The goal of our study was to describe to what extent physicians in the United States embrace the substituted judgment model for surrogate decision-making. To measure these beliefs and practices, we surveyed a stratified random sample of 2016 physicians by mail. For those not familiar with the substituted judgment model, it is a hierarchical framework that states how surrogates should make decisions on behalf of incapacitated patients. According to the model, surrogates should first follow a valid advance directive or the patient's explicit wishes. If there is no advance directive, however, or the patient's wishes are not known, then the surrogate should make a substituted judgment. This means that the surrogate attempts to make the decision that he or she believes that the patient would have made if the patient were able. Importantly, the surrogate should make the substituted judgment even if the surrogate and or the physician doesn't believe it's in the patient's best interest. Finally, if the surrogate does not know enough about what the patient's preferences are to make a substituted judgment, the surrogate should choose what is in the patient's best interest. We found that a majority of physicians agreed with the substituted judgment model in principle. In response to a statement indicating surrogates should preference a substituted judgment over what's in the patient's best interest, 78% of our respondents agreed. In addition to measuring physicians' in-principle agreement with the substituted judgment principle, we also attempted to describe how physicians respond to substituted judgment in practice. To do this, we used a clinical vignette. In the vignette, we presented a case of a 60-year-old patient with a previous history of peripheral vascular disease who was admitted for osteomyelitis and sepsis. It is determined that an urgent amputation is needed to save the patient's life. We presented respondents with 3 variations of the vignette. In the first, the patient himself refuses surgery. In the second, a surrogate refuses surgery using a substituted judgment. And in the final version, the surrogate refuses surgery using the patient's best interest. We then asked respondents to describe how appropriate it would be to overrule one of these refusals. We found that physicians were 4 times more likely to oppose overruling a surrogate refusal that was based on a substituted judgment when comparing to overruling a surrogate refusal in the patient's best interest. Perhaps most interestingly, we found no consistent association between responses to the in-principle items about substituted judgment and the clinical vignette. This seems to suggest that physicians embrace substituted judgment in practice regardless about how they feel about it in principle. Additionally, previous researchers found that physicians who are older, male, or more religious are more directive with patients, which means that they are more likely to encourage patients to make the decision that they believe is best. Given this, we hypothesized that these would also be more likely to encourage surrogates to use the best interest model. However, we found no association between physicians' personal or professional characteristics and the responses to either the in-principle items or the clinical vignette. Our data suggests that the rationale that surrogates use when refusing life-saving treatment affects the likelihood of physicians accommodating those refusals. On one hand, this is good news, as it suggests that physicians have embraced the current ethical teaching, which preferences patients' autonomy over the more paternalistic model of choosing what's in the patient's best interest. On the other hand, previous research has shown that surrogates are often imperfect judges about what patients' preferences are. This means that when a surrogate refuses medically indicated, life-saving treatment, there's always the possibility that doing so is not actually what the patient would have chosen in this particular case. Clearly, these difficult scenarios cannot be completely anticipated or avoided. However, their possibility highlights a role for clinicians. By educating patients about the progressive nature of disease and describing to them the decisions they might have to make about their health care in the future, they can help patients plan and make arrangements. Additionally, these discussions can be an asset to other providers if clinicians can elicit and document patients' preferences about these predictable declines in health and function. Patients can take some comfort in knowing that physicians, regardless of their personal beliefs, largely accept the substituted judgment model for surrogate decision-making in practice. This should help to allay any fears that they might have that their preferences might not be respected in the event that they are unable to advocate for themselves directly. Perhaps more importantly, our study underlines how important it is for patients to identify their surrogates and to discuss their health care preferences with them. in addition to helping to ensure that their wishes are respected regardless of their ability to communicate. These discussions also help surrogates and give them some direction and some solace when they're charged with the important task of making decisions for their loved ones. Physicians give greater deference to surrogate refusals of life-saving treatment if those refusals are based on substituted judgment as opposed to what's in the patient's best interest. These responses were not associated with any personal or professional characteristics of physicians, suggesting that in practice, physicians largely embrace the substituted judgment model. Thank you for watching and have a great day.
We hope you benefited from this presentation based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.